The balloon sinuplasty is essentially a procedure that allows surgeons to create more room in the sinus, more room in the nose, clean the sinuses in a very minimally invasive way using balloon technology that enables the surgeon to find the correct functioning duct to the sinus, the correct natural opening, enter the opening atraumatically, and expand the opening using a balloon so that you've reestablished what the patient was supposed to have to begin with. We're not, in this balloon sinuplasty procedure, creating new openings. We're correcting the closure of established openings that God gave every patient that were supposed to be there to begin with. That procedure is extremely effective in doing that because it allows us to, number one, identify the correct opening that was supposed to be there, and number two, it allows us to open the opening atraumatically, so there's very little bleeding, very little discomfort, and at the end of the day, you've created a normal anatomical nose, sinusitis pathway, and a restored sinus airflow dynamics to the way they were supposed to be to begin with. It's a very effective, minimally invasive procedure that's done to allow restoration of normal nasal airflow and normal nasal airflow dynamics. Balloon sinuplasty is done as an in-office procedure without having to utilize the resources nor the cost of a traditional procedure with a hospital or a surgery center. So when you come get a balloon sinuplasty done, you are done in the office. You're not removing your clothes, getting in a gurney, going to a pre-op area. You're not being wheeled around a hospital. You're in the office, your family's close by, observing the procedure live while we do the procedure. And at the end of the day, you haven't really had much experience in terms of moving around or having any other issues with, time delays, emergency problems coming up. When your surgery is scheduled at 9, your procedure is at 9, and you should be done within an hour. That's how fast this procedure is. So we can control in the office all the aspects of the patient care. Preoperative care, intraoperative care, postoperative care, to even the level of when you leave the office, you leave with your prescriptions in your hand. No stop at the pharmacy afterwards. All the prescriptions explain to you how to use after surgery. Even a small warm blanket to take home with you that you use while you're recovering. So there's a way that the offices can control all aspects of your care versus going to a hospital or a surgery center where the doctor may be a great guy, but maybe the facility is not up to par. There's a problem. Maybe there's an emergency that comes in. So you never know what could happen to you going into a hospital or surgery center versus going into one of these facilities that just does this procedure. Everything is well-defined, planned, and it's unlikely to have a situation occur where we don't do what we said we were going to do when we were going to do it.